My name is Don Hunt. I am with the Sangamon County Department of Public Health. I am Director of Adult and Laboratory Services, and I am over the STD, STI prevention processes for the County of Sangamon, for Sangamon County. Well, we have new guidelines that just came out, and the differences are going to be with the treatment for gonorrhea. We'll see a major difference in that because the recommending 250 milligrams of ceftriaxone rather than the Cefixime because of the resistance that we've seen. And also, of course, a gram of zithromycin is what the Centers for Disease Control is now recommending. It certainly helps when more providers are providing screening opportunities because the faster we intervene, we know that some of these infections can be asymptomatic and we miss a lot by not screening. So the more we screen, the better we are at being able to treat. It increases our ability to treat adequately and prevent the spread of the disease. It's recommended that young people between the ages of 15 to 29 be screened for chlamydia and gonorrhea at least every 3 to 6 months, depending on their sexual activity. But we are seeing that there's a need for screening for HIV, hepatitis C, HPV, so people are more sexually active today and they have more access to have sex and not know their partners. So it becomes imperative that we pay attention to the day that we live in and the technology that people are using and that we provide a rapid response to sexually transmitted infections. Well, we're seeing between the ages of 15 and 29 a high rate of prevalence there. That's the highest rate that we're seeing, and that goes along with our national numbers, but it's with the population of Sangamon County, which is like, I think, 160 or so thousand people, per 100 people, we are higher than Chicago. We're third in the state with chlamydia, and we're in the 10th position with gonorrhea. So those are real issues that we as a community should be trying to address and wrap our minds around. We have HIV where we have officially a low positivity rate, but we see consistent numbers when more and more people are testing, that we're seeing consistent positives appearing for the first time. And of course, we know that HIV can be asymptomatic, but if we're not screening people and giving them an opportunity, then we miss opportunities to halt the further spread of that disease. Well, the legislation that specifically states that the name, the address, all of the demographic information should be present, the lab report day, the diagnosis. See, here's what gets tricky in that, because one physician may order the test and another physician may treat. And, but both have a responsibility to report because the physician that orders the test rather, is responsible for reporting the test, the diagnosis. The physician that does the treatment is responsible for reporting the treatment. And that sometimes seems to be confusing in the medical community. And we're available to answer any questions, so they can always call my office if they have any doubts or if they don't understand. Absolutely. I was just reading a small research from the Journal of American Medical Association, the pediatric division, where they suggested that only a third of physicians have a sexual history discussion with their patient. I think in the day that we're living in, sexual history should be assessed on primarily every patient. I remember some years ago having a discussion with a particular doctor, local physician, and her mindset was that because that she understood screening young people for STIs, but her mindset was that if people were married, that they no longer needed to be screened. And I would beg to differ, because what we're seeing are high rates of STIs across the spectrum. They are not exclusive to race, ethnicity, religious practices, marriage, or single, or age. People are having sex with other people, they're having sex with multiple people, and they should have the opportunity to be screened. Yeah, if the physician who the patient looks to as being the expert on their health does not show an interest in STIs or ask the questions, many times because of the nature of it and the embarrassment that is attached to it, and the stigma, and the fears of the diagnosis, people will not mention anything. I mean, we still have people that are afraid to screen for HIV. So they may go to a medical provider for years and never mention that they have never had an HIV test. And those are things that we have to change in our society. When a person comes into our office, that's one of the priorities that we get across right as we're building a rapport with them, that everything that we discuss is confidential, and that we don't share their information with anyone, so that people can feel like we are people that they can talk to. So translating that into the greater medical community, physicians, nurse practitioners, physicians' assistants, nurses should express that same level of confidentiality and let their patients be assured that this information is only going to be used to assist them with adequate treatment and diagnosis. There are a lot going on right here in Sangamon County. The Sangamon County Department of Public Health would be one major resource for medical providers and for patients, for information, for education. We will provide education for people if they just walk in the door and say, I'd like to know more about gonorrhea, chlamydia, syphilis, and HIV. By the way, those are there's part of the 5 that are reportable: gonorrhea, chlamydia, syphilis, HIV, and chancroid are mandated by Illinois legislation that when there is a diagnosis of one of those 5 things, that there is a mandate that the provider report that to the local health department, which is Sangamon County Department of Public Health here. Herpes and HPV are off the chart. I mean, those are things that, it used to be that physicians would look at herpes and say, well, if you have it, you have it. There's nothing we can do about it, so let's not really spend a lot of time in it. But I'll tell you that those things, herpes and HPV, are portals, and they're gateway to other infections. Plus, they disrupt the quality of the patient's life. There could be a serodiscordant relationship. So education on how to protect their maybe not non-herpes or HPV infected partners becomes very crucial to a conversation.